Hello everyone and welcome back to my channel. In this video, I will be discussing about facts, future and success rate of vertical disc replacement. I will also be sharing some tips for recovery after the vertical disc replacement surgery. I hope that this video is helpful for anyone who is suffering from spine pain or is interested in learning more about this common fact for infection. Vertical disc replacement is a surgical procedure in which a damaged or degenerated spinal disc in the neck or back is replaced with an artificial disc. This procedure is typically done to help alleviate symptoms of pain, numbness, tingling, and weakness caused by a herniated or degenerated disc. Vertical disc replacement aims to restore normal mobility and function to the affected area of the spine, while also reducing the risk of future disc degeneration and adjacent segment disease. Vertical disc replacement refers to a type of artificial disc replacement surgery in the spine, where the damaged or degenerated disc in the cervical, neck, or lumbar, lower back, region is replaced with an artificial disc implant. This procedure is designed to preserve motion in the spine, maintain flexibility, and alleviate symptoms caused by disc degeneration, such as pain, numbness, weakness, and limited mobility. During vertical disc replacement surgery, the surgeon accesses the affected disc through an incision in the front or back of the neck or back, based on the location of the disc to be replaced. The damaged disc is removed, and the artificial disc implant is inserted in its place to restore normal disc height and function. The artificial disc is designed to allow for controlled motion and distribute pressure evenly on the surrounding vertebrae. Vertical disc replacement is considered a minimally invasive alternative to traditional spinal fusion surgery, as it aims to maintain mobility and reduce the risk of adjacent segment disease that can sometimes occur after fusion. This surgical technique may be recommended for patients with specific criteria who have not found relief from conservative treatments for symptomatic disc degeneration. As with any surgical procedure, the decision to undergo vertical disc replacement should be carefully evaluated by a spine specialist, considering the patient's individual condition, overall health, and treatment goals. Post-operative rehabilitation and follow-up care are important components of the recovery process following vertical disc replacement surgery. Vertical disc replacement is a relatively newer surgical technique compared to traditional spinal fusion surgery, and it offers several advantages for patients with symptomatic disc degeneration. Here are some facts and future trends regarding vertical disc replacement. 1. Motion preservation. Vertical disc replacement aims to preserve natural motion in the spine by replacing the damaged disc with an artificial one that mimics the function of a healthy disc. This can help maintain flexibility and reduce the risk of adjacent segment disease compared to fusion surgery. 2. Improved outcomes. Studies have shown positive outcomes in terms of pain relief, improved function, and patient satisfaction following vertical disc replacement. The procedure has been found to provide long-term benefits for many patients with symptomatic disc degeneration. 3. Advancements in technology. Ongoing advancements in implant design, surgical techniques, and imaging technology are driving improvements in the outcomes of vertical disc replacement procedures. Future developments may further enhance the effectiveness and safety of this surgical option. 4. Patient selection criteria. As more research is conducted on the outcomes of vertical disc replacement, refinements in patient selection criteria are likely to evolve. Identifying the most suitable candidates for this procedure based on specific factors such as disc condition, location, and overall health will continue to be a focus for healthcare providers. 5. Minimally invasive approaches. Minimally invasive techniques for vertical disc replacement are being developed to reduce surgical trauma, shorten recovery times, and improve outcomes for patients. These approaches may offer additional benefits for certain patients undergoing this procedure. Overall, vertical disc replacement is a promising option for addressing symptomatic disc degeneration in the spine. And ongoing research and technological advancements are expected to further refine and optimize this surgical technique in the future. Patients considering vertical disc replacement should discuss the latest developments and treatment options with their healthcare providers to make informed decisions about their care. What is the success rate of vertical disc replacement in relieving pain and improving mobility? The success rate of vertical disc replacement in relieving pain and improving mobility can vary depending on various factors such as the specific condition being treated, the patient's overall health, and the skill of the surgeon performing the procedure. However, studies have shown that vertical disc replacement can be an effective treatment option for many patients with symptomatic disc degeneration. According to the Spine Journal, multiple clinical studies have reported positive outcomes following vertical disc replacement, with a significant reduction in pain levels and improvement in mobility and function. Some studies have reported success rates as high as 80 to 90% in terms of pain relief and improved function. It is important to note that the success of vertical disc replacement also depends on proper patient selection, adherence to postoperative rehabilitation protocols, and ongoing follow-up care. Patients should discuss the potential risks and benefits of vertical disc replacement with a qualified spine surgeon to determine if it is the right treatment option for their specific condition. Are there any specific criteria for being a good candidate for vertical disc replacement? Yes, there are specific criteria that are typically considered when determining if a patient is a good candidate for vertical disc replacement. Some of the common criteria include: 1. Symptomatic disc degeneration. Candidates should have symptoms such as neck or back pain, arm or leg pain, numbness, tingling, or weakness that are not responding to conservative treatments like medication, physical therapy, and injections. 2. Disc location. Vertical disc replacement is generally performed in the cervical, neck, or lumbar, lower back, regions of the spine. The specific location of the damaged disc will determine if a patient is a good candidate for this procedure. 3. Disc condition. Candidates should have a single-level disc degeneration with no significant degeneration or instability in adjacent discs. The disc to be replaced should be the main source of the symptoms. 4. Overall health. Candidates should be in good overall health with no major medical conditions that could increase the risks associated with surgery. Patients should also have realistic expectations about the potential benefits and risks of the procedure. 5. Failed conservative treatments. Candidates should have tried and failed to find relief from their symptoms through conservative treatments before considering vertical disc replacement. Ultimately, the decision to undergo vertical disc replacement is made on a case-by-case basis by a spine surgeon after a thorough evaluation of the patient's medical history, imaging studies, and physical examination. Patients should discuss their individual circumstances with their healthcare provider to determine if they are a suitable candidate for this procedure. Can you explain more about the artificial disc implant used in vertical disc replacement? Certainly. The artificial disc implant used in vertical disc replacement is a medical device designed to mimic the function of a natural spinal disc. These implants are typically made of biocompatible materials, such as metal or high-grade plastic, that are durable and safe for use in the body. The design of the artificial disc implant allows for controlled motion and flexibility in the spine, aiming to maintain normal biomechanics and reduce the risk of adjacent segment degeneration. Key features of artificial disc implants used in vertical disc replacement include: 1. Two-component design. Most artificial disc implants consist of two components that are designed to replicate the structure and function of a natural spinal disc. These components are typically made up of a metal end plate that attaches to the vertebral bodies and a soft, polymer core that allows for motion and absorbs forces during spinal movement. 2. Ball and socket or sliding design. The articulating surfaces of the artificial disc implant can have a ball and socket design or a sliding mechanism that allows for controlled movement in multiple directions. This design helps to maintain flexibility and range of motion in the spine while providing stability and support. 3. Porous coating. Some artificial disc implants may have a porous coating on the end plates to promote bone fusion and facilitate the integration of the implant with the surrounding vertebrae. This helps to improve the long-term stability and function of the artificial disc implant. 4. Size and shape variability. Artificial disc implants come in a variety of sizes and shapes to accommodate the different anatomical variations of patients and the specific location of the disc to be replaced. The selection of the appropriate implant size and design is crucial to achieving optimal outcomes following vertical disc replacement surgery. The choice of artificial disc implant used in vertical disc replacement depends on various factors, including the patient's individual anatomy, the location of the disc being replaced, and the surgeon's preference. Patients considering vertical disc replacement should discuss the details of the artificial disc implant with their healthcare provider to understand the potential benefits and risks associated with the procedure. Can you explain more about the specific types of artificial disc implants available for vertical disc replacement? There are several types of artificial disc implants available for vertical disc replacement surgery, each with its unique design features and benefits. Some common types of artificial disc implants include 1. Constrained or semi-constrained disc implants. These artificial disc implants have a more limited range of motion compared to unconstrained implants. Constrained or semi-constrained implants are designed to provide stability and prevent excessive motion in the spine, which may be beneficial for patients with certain spinal conditions. 2. Ball and socket disc implants. This type of artificial disc implant consists of two components that articulate with each other in a ball and socket manner. The design allows for multidirectional movement, closely mimicking the natural motion of a healthy spinal disc. 3. Elastomeric or polymer disc implants. These artificial disc implants are made of flexible materials, such as silicone or other elastomers, that provide cushioning and shock absorption properties. Elastomeric disc implants are designed to replicate the natural flexibility and load-bearing capacity of a healthy disc. 4. Metal-on-metal disc implants. Some artificial disc implants use metal-on-metal articulating surfaces to facilitate motion and durability in the spine. Metal-on-metal disc implants may be a suitable option for patients who require a more robust implant design. 5. Composite disc implants. Composite disc implants combine different materials, such as metal and polymer components, to provide a balance of stability, flexibility, and durability. These implants are designed to withstand the forces and stresses experienced by the spine during movement. The selection of the most suitable artificial disc implant for vertical disc replacement depends on various factors, including the patient's specific condition, anatomical considerations, and the surgeon's expertise. The choice of implant type and design is individualized to each patient to ensure the best possible outcomes following surgery. Patients considering vertical disc replacement should discuss the different types of artificial disc implants with their healthcare provider to understand the options available and determine the most appropriate implant for their specific needs. How much time would be for recovery after vertical disc replacement surgery? The recovery time after vertical disc replacement surgery can vary depending on individual factors such as the patient's overall health, the specific disc being replaced, and any complications during surgery. Generally, patients can expect a gradual recovery process following vertical disc replacement, with specific timelines as follows. 1. Hospital stay. Most patients will need to stay in the hospital for a few days after vertical disc replacement surgery to monitor their recovery and manage any postoperative pain. The length of the hospital stay will depend on the individual patient's progress and any specific circumstances. 2. Immediate postoperative period. In the days immediately following vertical disc replacement surgery, patients may experience some pain, swelling, and discomfort at the surgical site. Pain medications and anti-inflammatory drugs may be prescribed to help manage these symptoms. 3. Gradual return to activities. Patients are typically encouraged to start moving and walking shortly after the surgery to prevent complications such as blood clots and promote healing. However, heavy lifting, twisting, or bending may be restricted for several weeks to allow the implanted disc to settle and fuse properly. 4. Physical therapy. Patients will likely be prescribed a physical therapy program to strengthen the muscles around the spine, improve flexibility, and optimize the function of the artificial disc implant. Physical therapy may start in the hospital and continue for several weeks or months after surgery. 5. Full recovery. The full recovery time after vertical disc replacement surgery can vary, but most patients can expect to return to normal daily activities within 6 to 12 weeks. It may take several months to achieve maximal strength, flexibility, and function in the spine following this procedure. It is essential for patients to follow their healthcare provider's postoperative instructions, attend follow-up appointments, and adhere to prescribed rehabilitation exercises to optimize their recovery after vertical disc replacement surgery. Patients should also contact their healthcare provider if they experience any new or worsening symptoms during the recovery period. Thank you for watching, and don't forget to like and subscribe for more videos on health and wellness. Take care and see you in the next one.